So good afternoon. Good afternoon. So take a few more bites, and then we're going to start our plenary session for today. My name is Scott Schomburg. I'm the board chair for the Alaska Coalition on Housing and Homelessness, and I'm really excited to be able to introduce our plenary speakers today because it involves the Juneau Housing First Collaborative Forget Me Not Manor project, 32 units of supported housing with a healthcare clinic attached in Juneau. As I was thinking about opening this session tonight, I started to think about how long it took to get this project online. Realistically, the project started with a conversation in Juneau in 2010 when city officials, police department, persons experiencing homelessness all got together in a 50-person meeting and said, hey, we need to find some solution for people who are chronically homeless in our community, and doing so for a very, very long time. We've come a long way as a state since that time, because one of the first questions that we had to ask were like, how many, who were homeless? And so we got out of the understanding stage of who our population was, and then the next question was like, what would be an appropriate intervention? And that time we had to go and figure out what was supported housing. We had to do many, many conversations in our community when we had to explain the term permanent supportive housing, meaning it's permanent, right? They don't have to leave. It's supportive, meaning they're going to have services attached, and it's housing, which is the fundamental need for most of our folks in town. And so through that time, we ended up touching on a lot of other systems. We relied on a lot of expertise through the state, and so I was thinking, who in this room has had, some sort of assistance to help this project in Juneau get up and running? And so a quick show of the hands. Who has referred a client? Who has provided funding? Who has provided verbal support to network people in Juneau? So how many people in this room have been a part of making this project in Juneau happen? Don't be shy. Public officials, outreach team, where's all of our funders, right? Where are all the other community members in Matsu, Fairbanks, Corinne O'Neill, who provided the pro forma? A show of hands for if you had just good thoughts about getting more supported housing in the state, right? Good thoughts, right? And so I think the main point here is it took us from 2011 to 2016 to get this project up and running. The challenge for us in this group is to figure out how can we get more supported housing in smaller communities where we know there's a chronic homeless need and do it in a shorter amount of time. So that's the challenge for all of us who are interested in promoting supported housing projects all throughout the state. And so as I introduce our plenary speakers, what you kind of realize is that this result and these bits of information about how the project is going is really a reflection on all the hard work that we've all done in the state to make this a reality. And so I'm really excited for you to hear some of the data that's coming through and being collected by our evaluation team. And so first I'm going to introduce Dr. Heidi Brocious, who's a UAA professor working down in Juneau at the UAS campus, who's leading the evaluation team. And then she'll go ahead and introduce Morgan Erisman through her presentation, who's on site at the Housing First project almost every day and doing a lot of the legwork to collect this information. So big round of applause for Dr. Heidi Brocious and Morgan Erisman.
Thank you. Thank you very much. You guys able to hear okay? I'm not a performing artist, so tell me if my mic is not at the right spot. I want to just say, first of all, I'm not a housing expert, so it's really amazing to sit among you all and see how much time, energy, resource is dedicated to this issue across the state. I became connected to this program because I have a fundamental belief that data helps fuel the work that we do. We can love data, we can hate data, we might think data and lunch, who paired this together, right? But we all get a sense that there's power in data, and the people that aren't convinced of the work that we do, people that are not sure that this is the right direction to go, data can be really that turning point. So that's one of the messages we're going to talk with you about today. I introduce Morgan Arisman. Morgan is a recent graduate of the Master's Social Work program and did a lot of this work as a part of her thesis for both that and her MPH, and has graciously continued on past graduation to really do a lot of the key work on this project. So I want to just acknowledge that. All right, and I have my list of who's doing what slides, Morgan, so if you want to come on up.
Hi, everyone. So Forget-Me-Not Manor opened in Juneau, Alaska last September 2017. It's 32 single occupancy units, and there's an on-site medical clinic that's run by the agency that I work for, which is Jamie Health and Wellness. In there, there's a PA, a nurse, myself as the clinician, and then a case manager as well. And there's 3 organizations that are involved in the operations of Forget-Me-Not Manor. There's the Glory Hall, which provides the 24/7 staff, the program director, and the residential support services that are there. And then there's St. Vincent de Paul that runs the landlord and helps with all the paperwork and all that. And then Jamie Health and Wellness that does the on-site clinic. So research to date on effectiveness of the Housing First model. Housing First has been around for a long time. I know you guys know that. You have some in Anchorage and Fairbanks. And it's shown to decrease the costliest service utilizations. It also increases days that people have been housed. Support services that are built into Housing First help show that people get access to coordination and different levels of care, which also helps reduce the emergency room services, which you guys will see in our coming data slides. It also has shown to reduce the costs for those the most expensive services and outweigh the cost to run the Housing First facility. What we also found in our project is that you'll see is that individuals who have become housed also express feelings of shame and hopelessness, but over time that kind of helps fade away and with more support services. We've found that providing one service alone doesn't help with people that have co-occurring disorders, and that individuals who move into housing also report feeling a little disoriented about their new housing and their alcohol use.
So one of the things that I was told early on when I offered to jump in on this project was that, it takes a long time to change. Please don't don't set the bar that we're looking for big changes at 6 months, because we understand that supported housing takes time for change. And so that was the mindset that we went into in looking at this. It's particularly true around drinking, I was told. And so we went in looking at 6 months, prepared to have this idea that maybe nothing has changed, and that's okay, because we understand that there's a long period of time. We have been pleasantly surprised. So what we have and what we've proposed is a 3-year evaluation, but with an emphasis on early data. So we really wanted to hit that 6-month mark and be able to turn around to people and say, within 8 months, here's what we know, right? Because one of the challenges that evaluation can present is that it takes a long time, right? By the time that stuff gets turned back around, if you do a long evaluation and you wait 3 years to get that information, the bus has left the station. And so really wanting to emphasize that we're giving our community a quick feedback data loop so that decisions could be made based on what's happening now. The Housing First board asked that we look at 2 things. They wanted to know about service use. Has Housing First changed the service use of the tenants that live there? And the second thing they wanted to know about is tenant well-being. Are people's lives improved? So that was our driving force when we looked at, when we set up this evaluation and designed it. We are at the official 1-year mark, and we've had data since July. When we hit our planned timeframes were 1 year, 2 year, and 3 years. One of the things that we've noticed is that there was some turnover in the beginning of Housing First. People that needed other types of housing. There were several unfortunate deaths at Housing First, and so we've had a slower ability to catch all of the participants. So we're now at a place where we can catch people, but it's more like at the 1.5 year mark. So our timeline is a little stretched, but we want to be able to look at the whole group if possible. So We're hoping to have some 1-year data available sometime this winter when we look at some of these issues, and then 2-year data and 3-year data. The other piece that we've done is at 6 months we went out and talked with the community. We talked with the residents, we talked with the people that live downtown, people that work downtown, we talked with the police department, we talked with the emergency services providers, and we asked, what have you noticed, or have you noticed anything? So that data is going to be forthcoming here soon, right? So that's our 3-year plan, but what we're talking about today is the 6-month data that we've collected. So just to tell you, and I wanted to say too, there were 50 of these handouts, and I put them on the desk, and I apologize there were only 50. I didn't know how many of you there were going to be, and 50 was what my little printer could handle. So if you didn't get one, I have it electronic. I'd be happy to send it to you. You could look over your neighbor, but most of the data that you're going to see on the coming slides is on the data sheet handout, which we made very intentionally to be user-friendly. Not a lot of words, lots of pictures, right? Things that you can take back and share and remember about our particular data. Okay, so what do we know about our residents? This is based on 27 tenants out of the 32, so it's a fairly strong representation, almost a census. We know that about 73% of our residents are male, 27 are female. About 84% of our population is Alaska Native or American Indian, 12% are Caucasian, and 4% identify as mixed race. Some really interesting things that we learned. People were really surprised by this data when we look at the education level of the residents. 4% have been to graduate school. 15% have some college or a college degree. 12% have been to vocational education, and 65% have either their high school diploma or their GED. Only 4% have less than that, which surprised us, and it surprised a lot of people when we talk about, what are the myths about who this population might be. We took a look at their employment when they moved in. What was their employment status? At that point, 50% were disabled, 27% were unemployed and looking for work, 11.5% were not looking for work, and 11.5% were employed. That's changed just a little bit. You can see that another resident or two qualified for disability services. There's been a little decrease in employment, which we can attribute to some seasonal aspects, and a greater number of people looking for work. We looked at the median number, right? Not the average in case there was really a large outlier, but we looked at the median number of months homeless and found that the individuals, tenants at Housing First, Forget-Me-Not Manor, have approximately 10 years of homelessness. So that's the typical time in which the members of the residents of Housing First have been homeless. We asked about adverse experiences, and we don't qualify these specifically as adverse childhood experiences because the questions don't say childhood, but what we know about adverse experiences tells us a lot about what we know about what people need. And we found that 88% lived with somebody who abused substances, 73% were living where they did not have enough to eat, had dirty clothes, or were not safe. 77% lived with somebody who went to prison. 69% were physically mistreated. 46% lived with somebody who was physically mistreated. 38% lived with somebody who attempted or committed suicide. And over half the population were either in foster care or had a relative who was in foster care. So that tells us what we know, but sometimes those numbers are really powerful to remind us of the trauma and life hardship that our populations have faced. Now here's the data that we are really excited, well, we're all excited about it all, but this data in particular we're really excited about because one of the questions was service use. So what are the services that residents in supported housing might use a lot of? Anyone? ER, right? ER, absolutely. Frequent users of the ER, much sometimes to the ER's frustration. What else? There's a cheat sheet up on the board if you want to look. Right? Rainforest sleep off. In our community, we have a sleep off center at the treatment center. So if you are intoxicated, you can be checked out by the ER and then sleep it off for the night. So that's a service that we were looking at. It's an emergency service. It's not an intervention service. And so we wanted to look at that data. Police department contacts, right? Lots of police department contacts. And then finally, transports by the ambulance. These are the things that we heard were really high use aspects. So we took a look at these. And I just want to talk a little bit about how we found this data. All of the tenants were consented to give a release of information and let us go ask. So Morgan went to the emergency room. Morgan went to the sleep-off center. Morgan went to the police department. Morgan went to Capital City Fire and Rescue and said, how many times did you see these person and on what days? So this is a count provided by these actual providers, which is really important because it's their data. So when we go back to them and say, look at how your data has changed, that data has come from them. We have seen startling decreases. 60% decrease, right, in ER visits. 98% decrease in use of the sleep-off center. 70% decrease in contacts with the police department based on these 27 participants. And 52% half decrease in use of ambulance transports. So you think about that for a city that has small resources, that is resource challenged. That is a huge net gain in terms of less use of emergency services in ways that may not be appropriate. So I just like to do a visual, right? Because we want to look at how things look when you line them out. So these are trend lines. If you look at the blue is police contacts, really high numbers, surprisingly, of police contacts. Gray is the emergency room visits. Orange represents sleep-off center, sleep-off. And the last one, green, is police contacts. So, what, yellow? Sorry. Ambulance, and I forgot ambulance services is in there. So you can see what, and the point of demarcation is the point at which they moved in. So you can see this really visualized in a way that says that's been a profound drop in services. Is that you? Oh. So this is a little bit of data. This is actually really data as of yesterday, right? Because one of the things we were told from the beginning is do not expect change in alcohol use, right? That happens when it happens. If it happens much later down the road. Well, guess what we're finding at 6 months? Changes in alcohol use. Slow changes, but we're seeing changes nonetheless. So there's two columns of data that you're looking at. The one that you see on the left is number of days they self-report that they had one or more drink. This is not statistically significant, so if you're a stats nerd, you'll know, we're watching this. This could be a trend, it could be a blip. But we're seeing fewer number of days, right? The data that is statistically significant is those days where people are drinking 4 or more drinks. And that number has gone down from 17.38 days per month all the way down to 12.84 days per month, which is a vast decrease in binge drinking. Morgan's going to talk with you now about the rest of the well-being indicators we've been looking at.
So we asked the tenants to talk about their physical health and how many days that they had poor physical health in the last 30 days before they moved in and then after. And this was shown to be statistically significant. They reported almost 19.5, almost 20 days of really poor physical health. And after 6 months later, after moving in, it went down to almost half of 30 days, 14.8, which was a significant decrease. And that correlates to the less ambulance, less ER visits, all of those things, along with having the on-site medical clinic and being able to have case management take them to primary care doctor appointments and engage in more of those services. They're able to get their health care needs met. We also asked them about safety and how they feel about being safe in their home and in the community. And this is a decrease, but an increase, but a positive increase. So before moving in, they didn't feel as safe in where they slept and didn't feel as safe outside their home. And after moving in, they have felt more safe. So this was on a scale of 1 to 7. And so before moving in, it was about dissatisfied there. It was a 3. And then after moving in, it was more on the satisfied to really pleased there, up to a 5.5, 5.84. And same with safety outside their home. It was very dissatisfied and then went up to feeling satisfied. So they're feeling more safe in their home, safe outside. This next one looks at feeling bad about yourself, or feeling like you are a failure, let yourself or your family down. And this was something that they answered regarding the last 14 days. And this was also statistically significant. So a lot of them reported that they felt 6.5 days of feeling bad about themselves, and then after 6 months later after moving in, they felt only about 3 days of feeling bad about themselves. This one was again on the scale of 1 to 7 about how they feel about their ability to meet their basic needs. So before moving in, they felt really dissatisfied about being able to meet their basic needs, and now after moving in, satisfied with it. So we can correlate this to Housing First because of the significant level. And this last one here is, in the last 2 weeks, how many days did you feel distant or cut off from other people? And this is something that was statistically significant, but they feel more distant and cut off from other people. And so they felt, before moving in, about 2.65 days, and after moving in, about 5 days. And so we're looking at this. We're looking at why they feel cut off from other people. Maybe it's because some of their people are still living on the streets, still homeless. We're also, where the Housing First is located is not downtown, where before they had been living on the street. So it's in the Lemon Creek area, so they actually have to kind of like get on a bus and go and see their friends. And a lot more people, I think, are isolating, staying towards their room, and just getting adjusted and feeling out their housing.
All right, I actually want to go back and talk about these indicators of well-being before we move forward just a little bit. So I think that how many people feel like it makes sense, right? You move into Housing First, you've been surviving in street culture, and then you suddenly feel more disconnected, right? So I think that makes a lot of sense to me. And I think it's one of those things that, we don't feel negative about that as an outcome. We use it as information. So we've been working with Housing First to talk about what are the things that we do to make sure, as we build our success, that more people are feeling connected. And I know that the staff at Forget Me Not Manor are really working to engage in some social, getting the culture of engagement around Housing First. So that's really useful information. You might think it a negative outcome. I think of it as an opportunity to grow your program. Moving backwards, or maybe forwards. Whoops. Well, now you'll never know. I think about we have several things going down, right? We have binge drinking going down. We have feelings of self-worth going up, right? Or at least days where you're not feeling like you've let your family down. That question, I don't know, how many of you are familiar with that? I think it's on the CSR, right? How many days do you feel like you let yourself down or let your family down or you're worthless, right? And then you think about that feeling of yourself, right? How many, don't raise your hands, but just think about that number for yourself. How many days in the last month have you felt like you are a disappointment to yourself, to your family, or to others? Don't raise your hand, but just think about what that number is, right? And that feeling that goes along with feeling like you let people in your life down. So that's gone down by more than half. They were having less than half the days do these individuals wake up and feel like, I'm a disappointment to everybody I know, I'm a failure. That is a profound gain in their sense of well-being, right? And that leads to some conclusions we can make about, well, when you're feeling less like that, what might you also feel less like doing? Binge drinking, right? And so these things are interwoven together. And I think that it's important to really talk about how they tie together. And I'm going to try not to mess this up this time, right? Safety. One of the things that we've heard over and over again is how unsafe it feels to be on the street. And to feel the sense of every day is not a challenge to meet your basic needs. I think that's a really compelling idea to think about. What changes in your life when you're not fearing for your life or fearing for your general safety? It's not just safety in their own apartments, it's safety when they're outside their home. So their overall sense of safety has been greatly impacted, and I think that also speaks to the kinds of behaviors that change. So changing the things that change behaviors that are unhealthy is really powerful. Feeling healthier, right? Where else did we see an increase? We saw an increase in people looking for work, right? Well, if you're feeling healthier, you have more days where you feel healthier, what are the chances are that you're going to feel more like going out and looking for employment? So these things are intertwined, and they're really powerful. And And so we're continuing to look at them. One of the other pieces of data that we're watching is we've noticed a very slight, not significant increase in people reporting suicidal feelings, but that also makes sense, right? When you come in and you're no longer fending for your basic needs, when you're no longer really worrying about where you're gonna sleep tonight, and will it be dry and will it be safe, you have time to have those emotional experiences. You have time to process the things that might come at that higher level, and that's good. It's not saying that more days of suicidality is good, but it's good that our tenants are being able to do the work that might help them get really healthy in the long run. And so we're looking at all these data and we're interpreting them and really using them to give feedback into the program. The final thing I want to talk about, well, I did it again. Oh, good. It's like when you take your grandma somewhere, right? I want to talk about the impact of rapid evaluation, right? Let me back up and say, this is a partnership like no partnership. This project has, Scott, what, $16,000 of funding. This is a $16,000 evaluation. Morgan volunteers her time, the university volunteers my time. We use the money for a few grad students and some grocery gift cards. So this evaluation does not fall in the realm of really expensive things that you can't afford. You all can do this. You all have the knowledge. And if you feel like you don't, there are people out there that will help you, right? Because this data is important. I will connect you with somebody that can help you feel confident in crunching your numbers. Because it's really important that we be able to turn to our community and say, this is a great idea, this is a compassionate thing. Those are all good things, but what do we have to say? We have to say, this works, right? Because whether somebody on your city assembly is for supported housing or is really behind the universal right to housing, or they're just wanting to not have a homeless problem in their community, this data speaks to them. When you tell them that police contacts have gone down a tremendous number, then you begin to get ears. On the bottom of this data sheet, I want to just read this off to you. This is what I'm kind of bouncing all around. So let me pause here and say, a year ago, I went to our city assembly, and our city assembly was having a hearing on whether or not we should have a camping ban. And it was a very contentious time in our community around housing and homelessness. I went with my pile of data to say, this isn't going to work. This is not an evidence-based practice. This doesn't have a positive outcome. But there was enough sentiment and fear and concern in our community that the camping ban passed. It was a very sort of defeating feeling at the time because we knew that this wasn't going to have any positive impact in our community. A year later, I got to go back to the assembly just a couple of weeks ago, so a week ago, a month ago, and I got to tell them about this data. And does anyone know what the Juneau City Assembly, Juneau City and Borough Assembly did a month ago? They voted unanimously to spend $1.8 million. Is it 1.8 or 1.4? Which probably shouldn't. 1.8 on an expansion of Housing First. It was a unanimous vote. There were applause. It was, so for our community to come from a place of tension and frustration and anger, business community versus social service provider and concerned community, and get to a place where we're all in support of something that's really working in our community is a really powerful transformation. Data helped pave the way for it. Data didn't do it, but it helped pave the way because people could see the value. Whether you are committed to housing as a part of a moral obligation or you're committed to housing simply as a resource, good use of resources, it was a place we could all agree. This was the data I shared with them at that meeting. So we have an ER at Bartlett. And I get the question all the time, well, what about costs? And costs are really hard to figure out, right? Because, well, if you drop police contacts, you don't lay off the police officer. It's not a cost savings. So what I've been talking to our community about is resource savings. What happens when you don't have to do these things? So in 6 months, by housing 27 people, there were 230 fewer visits with complex patients to the emergency room. That is 1.27 fewer visits every day. So where you or I or anyone in an emergency situation goes to the ER, that's 1.2 fewer every day people that are there that maybe that's not the best intervention for them. That's really profound. What difference does that make on your ER nurses, your doctors, those of us waiting? Our Juneau Police Department has had 495 fewer contacts over a 6-month period. That's almost 3 contacts a day. So what do those police officers get to do in our community when they're not having 3 contacts with individuals that really don't need that level of intervention? Our sleep-off center, what can they do with 352 fewer nights supervising a person? This is almost 2 people every night that are not at the sleep-off center as a result of housing 27 people. Right? And then you talk about ambulance transports. One of the things when I went and interviewed ambulance workers, they said, we don't have enough in our community, right? If an ambulance from the center part of town, and Juneau's not that big, but for us, right, the center part of town winds up on the far reaches of its, if you guys know Juneau, if you wind up in Lemon Creek and then you have a call all the way out the road, that's the ambulance that serves. That's a major stress for our community. Well, housing 27 individuals dropped our number of ambulance transports by 3.4 per week, which is for a small emergency services program. That is a large drop in service use. So I'm really talking with our community about what's changed, what resources are freed up to do the things that maybe they were intended to do, or to do the things that maybe they don't have enough resources to do. And that's the conversation we're trying to have with our community. And our community's been listening, and it's really exciting. So on that note, Morgan and I really want to thank the Alaska Mental Health Trust Authority. They gave the $16,000 or $17,000, which gave gift cards. We were able to give grocery gift cards to hopefully get people to participate, and the tenants were really lovely about that. Want to thank the people that provided data, because that was no easy task. Morgan got to go to the hospital, to the police department, to the fire and rescue department, along with the city, and say, can you give us these numbers? And can you still give us these numbers? And could you give us a few more numbers? And they've been gracious in sharing. The staff and leadership at both the Forget Me Not Manor, Daisha, who's been amazing, and all of our staff that have folded people in and let us just swoop in as researchers, and then leadership at the Glory Hall, and then most importantly, the tenants. It's been a real honor to be able to speak with them and ask them difficult questions, and they have been as excited about the data as we are. We were able to sit down with them over the summer and share the numbers back with them first and see what they think. And they're proud of themselves. They're proud of the gains and the growth that they're making, and so we've folded them into this data process as well. So many thanks to them. Anything you want to add? Okay, so that's what's happening in Juneau. I should also say, if you didn't get a data sheet and you would like one, I can give it to Scott or anybody on the board, and they can email it to you. So if that's something that you'd like to have.
Sure, and so we have a few minutes for questions. So if there are any questions in the audience, I can bring around the mic.
Thank you for the presentation. That's wonderful information and a great job by your team. I'm curious about the location of the facility, because that's something we battle with, you know, the not in my backyard type of thing. So I was wondering if you could talk about that.
Well, you know, that might be a better question for Daisha to answer. That's not a part of our research evaluation, and so I don't really have a role in that. I'd be speaking out of turn. Sorry, Daisha. On the spot.
I love public speaking. So I don't know who asked that question. Okay, hello. We still, I mean, we try to be good neighbors, and there was some resistance. The board did a lot of outreach to the community that we are in to try to pave the way for an easy transition when we opened. And overall, it's gone really well. There's a few neighbors that I think are always gonna have a hard time and not really understand the project. And so we've had a lot of press lately, positive press, because of this data. And so I think, again, this just illustrates how important data is, because it's very black and white, and it says that the project works. And so I think even though some of our neighbors would prefer us to not be there, the data just highlights that it does work, and so they don't have as much fuel for their, you know, being upset that we are there.
If I can just add to that, I also think this is, you know, one of the things that I run into as I've gone around and presented is this idea that, well, now they're just, all these new people have just moved in as if there's like homeless slots, and right, and they're like 4 empty spots in Juneau, come on in. There's this perception, right, that things that people just come in and fill these spots. Or that maybe someone somewhere is shipping people into Juneau to create havoc in Juneau's, downtown community, right? It's a sense that you run into. And the pushback that I've always had too, because if there's any crime in your area, Housing First gets blamed. And so I think one of the things we need to push our communities to do is be sure, right? Don't falsely correlate things. The problems that we have in our downtown right now are not all about the homeless. And we need to be really clear that we address that, one, so we're not blaming populations that might not be creating a problem, but also so we invent and develop solutions that meet those needs. Like if we just assume that those that are downtown that are creating problems are all alcoholics, and that's what we do, that's not going to necessarily work. We need to find out. There's a whole subgroup of individuals with drug-related issues, and how do we help them on top of doing the programs that we're already doing, and making sure that our programs are not blamed for all community crime.
Okay, my question goes to the categories that you used when you were looking at the employment at move-in and 6 months. The definition for disabled, I was curious about that because you have 50% of the people as disabled, but then I noticed the number adds up to about 100%. So you had no crossover between someone who may have been disabled but was also looking for employment, or was disabled also considered a substance abuse? Was that considered disabled? So your definition of that.
So that's a self-report category on, is it we use the tools that we use to collect this data, because we thought, why reinvent the wheel? We use the AST and the CSR. So that's one of the questions, and it's self-report, and that's one of the mutually exclusive categories. So to answer that question, we'd have to go back and find out more, why that tenant answered it that way, how they determined that. We don't have that level of specificity because we didn't look at their work records. It was self-report.
I noticed on your resident demographics that you didn't have anything about veterans, and I was just wondering if that was an oversight or by design.
That's a great question. There is, again, because the tools that we used are those state sponsored AST and CSRs. Those don't have a question about veterans on them, so we don't have that information. But you're right. That is probably an oversight, and maybe that's an oversight on the state data collection tools we can address.
All right, so I know there's a lot of questions, but the whole hotel staff's kind of waiting for the next changeover, and we have to keep to our schedule. So we do have kind of a nice half-hour break here, so maybe Heidi, if you want to field some questions out in the pre-function room, that'd be great. We're going to have hotel staff come in right now and divide out these walls into 3 different rooms, so if you can kind of let them do their work there and be clear, that'd be great. But thanks a lot, Heidi.
Thank you.
Yeah.